So we're reporting on 3 periods today. From Friday to Saturday, we had 172 new cases diagnosed with COVID-19. Between Saturday and Sunday, we had an additional 153 new cases, and Sunday to today, an additional 174 more people were diagnosed with COVID-19. That's a total of 499 cases over the weekend, with 7 of those epidemiologically linked. That brings our total number of people diagnosed with COVID-19 in BC to 11,687. That includes 4,146 people in the Vancouver Coastal Health Authority, 6,244 in the Fraser Health Region, 243 people in the Vancouver Island Health Region, 611 people in the Interior Health Region, 355 people in the Northern Health Region, and 88 people who generally reside outside of Canada. That has gone down by 1 due to a data correction from Friday. We now have 1,639 active cases in the province, of whom 67 are in hospital, 19 of whom are in critical care or ICU. Sadly, we've had an additional 2 people who have died from COVID-19 over this past weekend, one of them in the Fraser Health Region and 1 person in the Vancouver Coastal Health Region. And we know how challenging it is to have a loved one pass away in these times, and how challenging it is for us to come together and mourn them. And our condolences go out to the families, to the care providers in both these cases, and to our communities who mourn their loss. We now have 4,028 people who are under public health monitoring, and 9,753 people who have recovered from COVID-19. We have 4 additional healthcare outbreaks that were found over the weekend. One at the Village in Langley, Rosemary Heights Seniors Village, the Zion Park Manor, and the Royal Arch Masonic Home. Unfortunately, a second occurrence of COVID-19 in that facility. And on a positive note, 2 of the recent outbreaks have been declared over. The Banfield Pavilion and the Yale Townhouse outbreaks are now both over. So that leaves us with 19 active outbreaks in our healthcare system, 17 in long-term care and assisted living, and 2 in acute care facilities, involving 932 people in long-term care, 536 residents, and 396 staff. We have 1 new community outbreak to report at J&L Beef Limited in the Fraser Health Region, and public health teams have been working with this facility, are on site and conducting contact tracing and making sure that the procedures are put in place to ensure workers are safe in that facility. And please, of course, continue to check the Health Authority and BC CDC websites for other smaller exposure events and for school exposure events. So there has been some questions that have arisen, not just here in BC, but across Canada and around the world, about a second wave. And one can say that we are in our second wave here of our COVID-19 storm in BC, but we have control over what that wave looks like, and we have shown that we can do that. There continues to be COVID-19 transmission in many parts of our province, and we know that this is expected. This virus has not gone away, and it has shown us that it is now quite able to hide and spread in our communities around the province. Encouragingly, we in BC are not seeing exponential growth. We do have more people in hospital than we did a few weeks ago, but that has also stabilized. What we are seeing is continued ongoing growth, and particular focus are hotspots, particularly where we have our largest population in the Lower Mainland. We need, however, to make sure that we are doing what we can to avoid a steep and sudden increase in new cases that we have seen in other parts of Canada, in our neighboring countries, and around the world. We know that this can happen, and when it does, it can overwhelm our healthcare system. And that is difficult not just for our frontline healthcare workers. It means it's more challenging to care for anyone who's ill, whether from COVID-19 or another illness. It makes it more difficult as well to keep those important things in our community going, like our surgery restarts and other services. Small sacrifices that each of us can make now will help us, help our community, and help control and support of our community to keep our priorities going. Our priorities like our surgical restart, like making sure our children are getting the educational and social and emotional supports they need in classrooms, like our businesses that are keeping people employed and keeping our communities well. It makes us very difficult to address the other critical health issues we have in BC, including our overdose emergency, if we have concerns with rapidly spreading growth of this virus. We know that these consequences of COVID-19 are far-reaching because the impact it has had on so many people in so many aspects of our society. This is why it is critically important we all remain vigilant so that we can continue, as we have been doing, to slow the spread as much as possible. We want and need to keep everybody safe and as many activities as possible open for all of us. This is the balance we are working to achieve. We have done it before, and we can do it again, finding that balance. And the way we do it is by each of us doing individual measures, like taking the precautions and using our layers of protection wherever we may be. Many of the new cases in these past few days are connected to new clusters and outbreaks, many of them small, but some larger, especially associated with our essential services, places like grocery stores, places like food processing plants, where we know there can be a challenge in managing. Our contact tracing teams are working around the clock to track every new case that emerges, and they are good at what they do. And we in public health have been working together to track every single case in this province, and we've been successful at supporting our communities and making sure we can find that balance of keeping our cases low. If you are contacted by public health, that may be because you've been exposed to this virus and there's a possibility you might get ill yourself. Public health is there to support you, to make sure that you can isolate and get tested if you need to. As well, by sharing information, if you are sick, about where you've been and who you've been with, will ensure that we can make sure that one case doesn't turn into 100. And by keeping our groups low and keeping our distances, wearing our masks when it's important, we can keep our transmission risks low in our community as well. Everyone in BC has a role to play, and we know that most people are doing this. We are making a difference in our own communities, in our own families. What we do personally helps everyone around us. And it also helps our public health teams, helps our healthcare workers who are busily in our facilities with our surgical restarts. It helps all of our essential workers, from food plants to grocery stores to the critical workers we have in our schools, our educators and staff. I know some things are easier to do than others. Cleaning your hands, wearing a mask, maintaining a safe physical distance is something all of us can do and are doing. Not seeing family and loved ones is much harder. It requires more effort and more sacrifice. But I want you to know that what you are doing is making a difference. It makes a difference for you, your family, your loved ones, for colleagues and friends, for those we know and those we don't know. Let's keep doing what we're doing, keeping our COVID-19 pandemic low and slow so that we can manage, so that we can continue to have the essential priorities open in our communities, and keeping our communities well. Please continue to do your part today and every day. And as I say, please continue to be kind, to be calm, and be safe. And I'm going to add to that today, to be brave, that we can get through this together and we can support each other. Thank you.